Hi, this is Rachel and Rachel, and we chose caffeine in sport as our aerogenic aid. Caffeine overall is beneficial as an aerogenic aid for endurance and resistance athletes, especially effective in time trial performances. Caffeine heightens athletic performance by suppressing feelings of fatigue, exhaustion, and pain, and it also increases focus and mental acuity.
In essence, caffeine helps an athlete work harder and complete an agility test in a shorter amount of time.
A study conducted in 2012, published in the journal Sports Science, found that men who consumed caffeine biked harder than when they did not consume caffeine with the same amount of apparent effort.
A study done on caffeine and nutrition concluded that caffeine is quickly absorbed through the gastrointestinal tract, and elevated levels of caffeine appear in the bloodstream within 15 to 45 minutes after consumption. Caffeine is an effective ergogenic aid that can be used shortly before performance time without complication.
Use of caffeine from coffee versus use of caffeine pills varies on the individual athlete and their preference. Coffee yields about 75 to 175 milligrams of caffeine per 8 ounces of a glass, while caffeine pills typically contain 200 milligrams of caffeine per pill.
The position of the International Society of Sports Nutrition is that caffeine, when consumed in low to moderate dosages, which is 3 to 6 milligrams per kilograms of body weight, is most effective, and consuming higher doses does not provide additional performance benefits.
A healthy adult can safely consume between 300 to 400 milligrams of caffeine, which is 3 to 4 cups of coffee or 1 to 2 caffeine pills, and this is in one day.
The International Society of Sports Nutrition also states that caffeine provides greater ergogenic benefit when consumed in a dehydrated state, aka a pill or powder form.
Caffeine pills cost around 6 cents per pill. Generic at-home brewed coffee costs around 30 cents for an 8-ounce cup, and the average cost for an out-of-home purchased 8-ounce cup of coffee without milk or cream is $2.70.
While caffeine pills are more cost-efficient and a better ergogenic aid than coffee, they provide greater risk for intake of toxic dose.
Caffeine is no longer on the World Anti-Doping Agency list for banned substances as in 2004, but it is still considered a banned substance by the NCAA if it's in greater amounts than 15 micrograms per milliliter of urine in an athlete.
While caffeine produces performance benefits, there are some downfalls. These side effects are anxiety, increased heart rate, upset stomach, and insomnia. Caffeine should also be taken with caution because it can have an adverse effect when combined with depressants and other stimulants.
Consumption of caffeine ultimately is up to the individual athlete's preference and comfort with risk, especially when choosing between coffee and caffeine pills. Our recommendation for caffeine consumption for athletes is when it is consumed in safe amounts, caffeine can be a beneficial aerogenic aid.